organization will not perform as well because you do not plan accordingly. So strategic management, as well as planning, is very, very critical for healthcare organization. It's not done annually, but it's done maybe like every 4 or 5 years, based on the company's mission as well as objective. So the nature of strategic management, that's what we talk about in chapter 1. So we have 2 chapters to cover today, chapter 1 and chapter 2. Before we get started, I would like to go through some of the learning objectives that we'll cover throughout this chapter, as well as in chapter 2. The first one is explaining why strategic management has become crucial in the dynamic of the healthcare environment today. Also trace the evolution of strategic management and discuss its conceptual foundation. Describe and explain the concepts of strategic thinking, MAP. Define and differentiate between strategic management and strategic thinking, strategic planning, and managing strategic momentum. Understand the necessity for both the analytic as well as the emergent model of strategic management. Understand how an organization may realize a strategy that is never intended. Understand the benefit of strategic management for healthcare organization. Understand the importance of system approach. Explain the link between different levels of strategy and within an organization, and describe how various leadership roles of strategic management. Describe various leadership roles of strategic management. So these are the objectives that we'll cover. So you will get each slide will kind of give you a bit of a nugget with regards to those objectives. So you have to keep in mind what those objectives are as we move through the presentation, so you can be able to make the connections. So what has changed basically in the external environment? So you have various things, you have various disruptors out there that are kind of, pushing changes throughout the industry. One of the main critical disruptors of that is causing most of the changes nowadays is technology. Technology has advanced to a point where it's changing everything: how we communicate, how we interact with one another, how we're able to connect with people all over the world. And so technology is kind of driving everything. I'm sure you have heard of Internet of Everything, Internet. So it's called IoT. So it's basically Internet and everything you touch, your car, your house, everything you can think of, it has Internet. Nowadays, your car has Wi-Fi. Everywhere you go, there's Wi-Fi, so you can be able to connect to the Internet. So the Internet and online banking is one of the most technologically advanced areas in technology that is kind of changing the way we interact with one another. Also, you have social and cultural aspects, on-demand consumer preference, desire for 24-hour service. So basically, how we live is also changing. Basically, having access to pretty much everything. Basically, having concierge services. Basically everything, your groceries being delivered to you nowadays, so etc. Demographic is also changing. Preferences, need for baby boomers as well as Generation Y. So basically, we have a lot of baby boomers retiring, and then we also have Gen Y also coming up. So it's like a tremendous shift in demographics. Also, political and regulatory changes such as security, privacy in the financial sector, as well as in the healthcare sector as well. Now we having hacks pretty much, I would say pretty much every day, because people's information are being stolen. Data are being stolen. People are being, their identity are being taken pretty much every day. So that's another main concern, as well as this in terms of how we protect our identity is also driving change in a lot of different areas. Having everything has to have password nowadays. In terms of how you display your information, you have to be very, very cautious in terms of how you share your information. So that is also changing. Economics, the housing boom, the housing bust, and the mortgage debacle. So that also has caused some changes in which people have to worry about, okay, how they invest, when they buy and when they sell their houses. Competitive in terms of, how the online industry are very competitive nowadays. Things change every day. On all these companies, they have to be very engaged. They have to plan ahead, and they have to anticipate a lot of these things, a lot of these changes happening. So that is why strategic management has come into effect, because it enables companies to be able to predict or anticipate some of these changes that are going on. Also, the customer is also changing. With online banking, customers are no longer need to be local, so they can actually bank with any bank out there, because they don't necessarily have to go to the location. They do everything online. So now, so the only constant is change. So that's one thing that you should have. So you have to keep in mind that changes is the only thing that is constant, because it happens all the time. So these are some of the changes that we've had so far. Yeah, we have legislative healthcare reform, increasing restrictive reimbursement environment. We have a demographical shift, the baby boomers, shortage in providers, high cost of new technology. Your iPhone nowadays is like $700. That's almost, a rent, your rent for 1 month, or depending on where you live. So it went from being like, $100 for a flip phone to like $700 for an iPhone, and everybody's buying those things. A high cost of, so we've talked about high cost of technology, further consolidation of the industry. Now you have a lot of margins that are going on. You have hospitals that are margin every day to create a create a larger hospitals. You have banks that are margin to create bigger banks. You have technology companies that are margin to create more of a market share. So you have a lot of consolidations that are going on. Growth of outpatient. So the last 5 years has due to the fact that cost of inpatient is definitely something that couldn't be controlled, because the longer you stay in the hospital, the higher the cost. So now you have a boom in which hospitals they decided to shift towards ambulatory care, in which they develop a lot of outpatient care, same day discharge type of setting. In which somebody can go and they receive care. They don't necessarily have to stay overnight in the inpatient setting. So they go there, they get discharged the same day. So you have growth in outpatient centers, growth in home health, changes in managed care strategies. Yeah, so now you have managed care organization. They are in terms of the level of quality that each provider have to go through or have to prove. So that has changed a lot, and also that is tied to the reimbursement of the providers. Increase in physicians, in executive leadership, so that is also increasing. Before, you used to have just your regular MBAs or your regular MHAs leading a hospital, but nowadays we have physicians who are also taking the helm of leading the healthcare organization. Emerging focus on prevention. So now we've shifted over from tertiary care to primary care, so that has changed our focus towards more preventive instead of towards preventive instead of just dealing with more emergencies. Pressure to reduce overhead costs, so that's another big one that is also changing perspective of healthcare organizations to be a little bit more strategically prepared to be able to handle that overhead cost, as well as the pressures that comes along with it. So foundation of strategic management. Um, so foundation of strategic management. We in terms of the where. Let's see, I have one question. Okay. In terms of where that word come from, it came from the Greek word strategos. So it means a general, which in turn comes from the root meaning army and lead. So Greek verbs strategos means to plan destruction of one's enemy through effective use of resources. So basically, planning and utilizing resources effectively to destroy one's enemy. So many terms were associated today with strategy. So we have various words such as objective, mission, strength, and weakness. So those are some of the buzzwords that you will hear when you hear a discussion about strategy. You hear especially objective and mission. Those are the two key words that are associated with strategy, because they drive strategy. They determine how strategy will turn out, because everything is tied to either the mission or the objective. So basically, we now in terms of there are various level of in terms of development of strategic management. So you have what is called a long range planning. You also have what is called strategic planning. You have the strategic management, and so these are some of the things that we'll touch upon. Basically, your long-range planning is basically your long-term planning, in which you have to kind of put resources together, but you have to also keep in mind what are your long-term goals when you do a long-range planning, because it's not something that is short-term. It goes for a long time, and whatever you decide to put down in your long-range planning, you have to stick with it, and your budget has to be able to support it. And then you have what is called strategic planning. It's also very close to long-range plan, but strategic planning can be short-term or it can be long-term, but more so your long-range plan is more of the longer term. So now, in terms of how our strategies drive in the healthcare setting, so basically a lot of strategy nowadays is driven by what is the healthcare policy, or what is the health policy. So basically, it determines the rule that apply to all consumers and providers. So now you have whatever the legislation is, or whatever the regulation is, that's what hospitals, that's what they have to abide by. So they have to develop a strategy in terms of being able to survive and being able to align with that policy. So basically, that's why they plan. If they say today they're going to cost reimbursements, so hospitals need to plan for that and make sure that they are able to maintain their overhead because of that cost crunch. So the policies, the healthcare policies, they rule strategic planning, and basically whenever you have a new legislation that is coming out, hospitals and healthcare organizations, they have to strategically plan against that policy so they can be able to ride the wave whenever it becomes effective. Basically, it is developed and maintained. So basically, hospitals develop and maintain an infrastructure to efficiently enhance the health of the public. The policy defines the institution that meets the preference of most of the society, develops the rule under which insurers and providers can compete. So basically, health policy drive all these things. It also is set by Congress, state legislatives, executive branch, as well as agencies such as the Health Department, Center of the CDC, the FDA. So these are various organizations that set the healthcare policy, the current healthcare policy in the country. But basically, a policy drives pretty much everything that goes on in the healthcare industry. And whenever there's a new legislation, healthcare organizations have to plan accordingly to be able to strategically align with that particular policy. So dimensions of strategic management is, so basically strategic management is a way of thinking. It's an approach for managing complex organization. Strategic thinkers draw upon the past, understand the present, and can envision the future better. While planners, on the other hand, figure out how to get where the strategic thinkers want to go. There are two. There are two versions of strategic management. So you have the map, as well as you also have the compass. So basically, the map is the analytical and the rational approach, the logical sequence of steps, as well as specific processes that enable you to better know the words. And then the compass is an emergent approach, relies on learning. Leadership set the direction, and it's better in an uncharted world. So there's two versions of strategic management, in which you have one that is like, the version of a map, and the other one is the version of a compass. So map and a compass, in terms of putting them together, you have a map is planned, a compass is imagined. So basically, when you have a compass, it just kind of rolls around and kind of points you to the direction that you want to go. But a map is, kind of tracing someone's footstep that has already been traveled. So you already, if you are following a map, you've already kind of following something that is already been charted. But compass is something that you don't know where it's going to point, except when it points you to that direction. A map is rational. Compass is, so basically this is like when you are comparing to these two different versions. You have one that is already been planned, which is you are a planner, and then you have a strategic thinker who is just in terms of not rational, very in terms of always looking to the future, in terms of not worrying about the present. A planner worries about the present. A strategic thinker takes risk. It's very revolution. So the strategic thinker basically kind of live in the moment, instead of being very conservative, or being in terms of being very careful. In terms of being logical versus illogical, a strategic thinker is more illogical, and a planner is more logical. Consistent, planner is more consistent, because that has already been calibrated and also standardized when you are following a plan. But in terms of a strategic thinker, you tend to change based on the wave of things. So when I say, when you have to think strategically, you have to kind of be able to evolve. You have to be able to change with regards to how things are coming, or how things are changing around you. So you have to be able to prepare yourself. All right. So in terms of the analytical and the emergent views, as a physicist, David Bohm observed, the purpose of a science is the accumulation of knowledge, but rather the creation of a mental map that guides and shapes our perception and action. So in terms of you accumulating knowledge, it's necessarily not, science is not necessarily the accumulation of knowledge. So basically, it's just to create a mental map that guides you to where you are going. So the same thing goes for strategic management. You don't necessarily accumulate knowledge of what is going on. So you basically be able to kind of create an environment where you can be able to be a little bit more nimble, or create a path to follow, so it can enable you to predict what is going to happen in the future if you plan accordingly. Hello? Questions? There's some noise on the line. Can everybody just mute your mic for me, please? Thank you.
Running like a shit. you serious that you burn?
Yeah. The steak, I like about this much of it.
Hello?
It's not too burnt.
Hello? Chris, can you please mute your mic for me?
Oh, shit. My bad.
Thank you. Okay, so now let's talk about some of the processes of strategic management. You have various processes that are involved in strategic management. So you have the strategic thinking, strategic planning, as well as managing strategic momentum. So in terms of strategic thinking, you have the external orientation, the analyze data phase, question, where you also question assumption, and then you generate ideas. Then you have your strategic planning. So the strategic thinking is more like your beginning phase where you're kind of formulating your ideas, where you want to go with things. You start asking questions. What are my objectives? How do I want to how do I want to calibrate my objective? How do I want to, what type of resources do I need? Do we have data to measure? So you ask all these questions. So you kind of develop an idea. So there's a lot of brainstorming going on in this phase of strategic thinking phase or the process. Then you generate your ideas. You say, hey, I'm going to measure, I'm going to do this, I'm going to do that. And if we do this and that, we will get here. Then okay, let's just do it. By then, you've already kind of got your your commitment from your leadership that would tell you, yes, you should go ahead. I will give you the resources that you need to move forward. You take that and then go on to your strategic planning process phase, in which you do situation analysis. You also do strategic formulation and then you go ahead and plan and implement. Your situation analysis involves various analysis. You do your external analysis. You look at, who's around you, what are they doing? Your competitors, what are they doing? Then you do your internal analysis. You look at your organization as a whole. You look at the resources that you have, the competencies within your organization to see if you can actually be able to carry out the strategic plan or be able to achieve your goal after everything is said and done. So you do that external and internal analysis. Then you also do a directional strategy to see if your processes are in place to be able to handle the new strategy. Then you go into your strategy formulation, also your directional strategies and the adaptive. So you do a lot of different strategies to kind of test things out to see where things are heading. But basically you have to, place your organization. All these type of strategies will be your organization centric. So your organization will be in the middle of every one of this, your directional strategy, your adaptive strategy, your market entry strategy, and your competitive strategy. So you will have a plan for each and every one of this and how you kind of, which direction that you would like to go with each and every one of this strategy. And based on whichever one that you are targeting, basically, if you want to increase your market share, basically your market entry strategy will probably be the way to go. If you want to be a little bit more nimble, or if you want to kind of adapt to a new policy, the adaptive strategy will be another way to go. Competitive strategy, if you want to be more competitive in the environment, if you want to, kind of edge out your competitors, the competitive strategy is the way to go. So you go into your planning and formulation or planning and implementation, in which you then, develop your service delivery strategy, implement your strategy. You have your service delivery strategy. You support your strategy with resources, and then you have your action plan. Managing your strategic momentum is another critical aspect, because you have to also maintain whatever you implemented. You have to maintain it moving forward. You cannot let it go. So basically, that involves, increasing your competency of your resources, being able to budget accordingly, or maintain your budget accordingly. If you don't maintain your budget, everything will fall apart. You also have to anticipate changes in strategy based on what is going on. So your strategy will evolve eventually. And then you have to reinitiate your strategic thinking and continue to, enhance that process. So, we've talked about, pretty much all this. We've talked about strategic thinking. It's an intellectual orientation, a way of thinking or mindset. Strategic planning is a periodic process of creating organizational momentum. Managing strategic momentum is a philosophy and process of continuously leading and managing an organization using strategic thinking and periodic strategic planning. So we've talked about, strategic thinking, strategic planning, and also managing strategic momentum. So in terms of how I've described pretty much all this, the orientation and the scope, strategic thinking can be done by individual. It's a leadership process. Strategic planning is a periodic group process. Leadership also is a periodic group process. Leadership and management also are involved in the process. Managing strategic momentum is an organizational management process. I've talked kind of, explained strategic thinking when I presented that table earlier. So it requires a mindset, a way of thinking. So you have to acknowledge the reality of change. You have to question current assumption and activities. You have to build an understanding of system, envision possible futures, generate new ideas, as well as consider fitting the organization into the environment. So strategic thinkers do not assume that the organization will continue to do what it is presently doing. Determine what the organization should stop doing. Determine what organization should start doing that is presently not doing. Also determine what the organization should continue to do, but perhaps in a fundamental different way. Strategic planning is to provide a sequential step-by-step process for creating a strategy. Involves periodic group strategic thinking sessions, require data and information use, uses consensus and judgment, establish organizational focus, facilitate consistent decision-making, determine what is required to fit with the external environment, results in a documented strategic plan. So basically, in linking today and tomorrow, so you kind of look at your profile of today, your mission, and then you develop a strategy that will lead you to the profile of tomorrow, your vision. And you have to budget and plan along the way. Like I said earlier, strategic process is mostly, it's usually 5 years. It's done in 5 years, 4 or 5 years. Sometimes some of them can go for 10 years, depending on how you want to look at it or how big is your vision. If you have a very large vision, then you might look at long term. But if you have a small vision, you have to look at a short term. But you have a short term objective with it along the way. You have your year 1, year 2, year 3, year 4, year 5. Certain things that you want to get done. So your mission is your big idea. Then you have smaller objective which you have to accomplish, what you want to accomplish on a yearly basis until you get to that big idea or your main vision. So managing a strategic momentum is an actual work to accomplish specific objectives. Concern a decision-making process and their consequences, provide the style and the culture, evaluate strategy performance, and it's also a learning process. It relies on and initiate new strategic thinking and new periodic strategic planning. Benefit of strategic management: it ties the organization together with a common sense of purpose and shared value. It improves financial performance in many cases, provides the organization with a clear concept, specific goals, guidance as well as consistency in decision making. It helps managers understand present things. It helps managers understand the present, think about the future, or recognize signals that suggest change. Requires managers to communicate both vertically and horizontally. It improves overall coordination with organization, encourage innovation and change within the organization to meet the needs of dynamic situation. So what strategic management is not a quick fix. It's not a technique or a gimmick. It just not just a yearly planning retreat, not paper intensive, not regulatory documents, not just an extension of last year plan, not just based on a forecast of the current operation. So in terms of what we've covered in chapter 1, we've covered various things, and these are various terms that are covered in chapter 1. I will not spend much time. All these terms are given in your book. I would now like to move into chapter 2, which involves understanding and analyzing the general environment and the healthcare environment. A little bit of some of the objectives that I would like to cover in chapter 2 is by the time we are finished with chapter 2, you would have been able to appreciate the significance of external environment impact on healthcare organization, understand and discuss the specific goals of environmental analysis, point out some of the limitation of environmental analysis, describe various types of environment or of organization in general and healthcare environment and how they create issues that are of importance to the other organization. Identify major general and industrial environmental trends affecting healthcare organization. Identify key resources of environmental information, discuss important techniques used in analyzing the general and healthcare environment, conduct an analysis of general and industrial external environment for a healthcare organization, suggest several questions to initiate strategic thinking concerning the general and industrial environment as part of the managing the strategic goals. So these are some of the objectives that we'll cover. And these are some of your learning objectives too that are for week 1 learning objectives. So external analysis, like I mentioned earlier, so you have to kind of, when you do external analysis, you have to kind of look at, it's an important task of an organization's leader to anticipate a crisis. So perhaps not to avert it, but also to appreciate it. One has to make the organization capable of anticipating the storm, weathering it, and then being ahead of it. So basically, your external analysis, you have to look at your environment and see what is going on. If you see your competitors that are transitioning over to a new system, and 3 or 4 of your competitors are doing the same thing, then you need to start asking questions. What is going on? As a leader of your organization, you have to analyze that environment and see why they are doing what they are doing, so you can also be able to do the same thing. But not necessarily, if you think strategically, you should be able to see what is coming. If you see, let's say now this is the election season, you know what is coming based on what the candidates are talking about during their campaign. You can kind of predict, okay, if they get elected, 1 or 2 things will happen. And some of those things they've discussed during their campaigning, some of those things will be a policy eventually. So if you're a leader, you should listen very closely. You should pay attention to what is coming along the way if any of these candidates get elected. Then if before they get elected, then you already know that it's going to be a policy. You start preparing your organization for that particular policy to take effect. Before then, you should also, in terms of how those things are being, what is being discussed with regards to those issues, you should also be planning accordingly. So that is what your external analysis is all about. Your external analysis is something that has to do with. It's not something that that has anything to do with your organization. It's what is happening around you in your environment. If you have a new company that is coming to your state, then you will anticipate a lot of different type of individuals coming in, because the company is coming. It's coming to build a factory, or it's moving to your state. So you should expect a lot of young people because of new jobs. So the demographic of your environment will change. So you have to kind of tailor your organization or tailor your business to be able to attract some of those people that are moving in. So that is basically, when you see something like that coming, you have to change your strategy. You have to change how you approach different age group, different type of population, in order for them to come to your business. So that's basically what strategic planning, external analysis help in strategic planning, in order for you to be able to understand what is going on. So now we go into situation analysis. So you have your external environment, your directional strategies, and then your internal environment. What can your internal environment? So basically, you have to look at your organization as a whole and see if you can be able to adjust to the new strategy. Sometimes you have to hire new people. Sometimes you have to let go of those people who've been working there for years, who you feel like, they cannot be able to, adjust easily to the new strategy. You'll bring in new people, or you can help those people who you think are lacking in some areas or need to improve their competence in some areas. They can improve their competency by, giving them training. So, whenever you have a new strategy coming in, you have to make sure that your resources, your organization is well prepared, as well as you have the competency, your staff have the necessary competency to be able to adjust. So you've done your external analysis, you've done your internal analysis. So now the need for the environment. So you have to ask a few questions. Does the external environment influence capital allocation or decision making? Have previous strategic plans been scrapped because of unexpected changes in the environment? Has there been any unpleasant surprises in the external? So in terms of your competition, you have to know what is going on. You have to know what has been done in the past, whether you've tried something before and it didn't work because of A, B, or C. So you have to know what those things are before you move forward, because you don't want to encounter the same roadblock that you encountered previously. You weren't able to achieve that goal because one or two things in the environment happened. So you have to, if you want to move towards a business and you are trying to, develop a strategic plan to be able to move towards that new business, you have to look at who in your environment is doing the same thing. If they have already done it, and if they have already kind of, capitalized on that particular business, chances are if you start the same business, it's not going to do well. So you have to think about it. You have to kind of develop a niche for yourself in order to prevent you from, having that type of failure in which you have to now compete with another company who've been doing that particular thing for over 50 years, in which they have people know them and they've kind of established in that area. So you don't want to go into that area. You also have to ask, is your organization or industry becoming more market oriented? You have to do more different kind of external facing. So you have to kind of look at what is the external forces, whether it seems to be influencing decision, and does there seem to be a more interplay between them. So you also have to see if whether management is unhappy with the past forecasting as well as planning efforts. So goal of the environmental analysis is to identify and analyze our current issues, detect and analyze possible emerging issues, speculate on future issues, to classify on other issues, identify organizational critical success factors, provide organized information for planning, as well as foster further strategic foster further strategic thinking. Limitation of environment analysis: it cannot foretell the future, does not detect everything. Sometimes information is not impossible to obtain, may be delayed in interpretation, inability to respond quickly, detection of issues blocked by strong belief. External environments, we've kind of talked about various, I've touched upon a few things that can influence strategic planning from the external environment. So one is the general environment, the government, institution, the business organization, other business organization, education institutions, religious institutions, research organizations, as well as your individual consumers. On the healthcare in the healthcare environment, you have your planning and regulatory organizations such as your JCO, your FDA, CDC, not your FDA, so CMS. Some of the regional, some of the QIOs such as your quality. Your QIOs, your quality organizations, the health department, your state health department, your regulatory agencies, the primary care providers, the association, the secondary providers, the associations, provider representative, and the associations, individual patients. So those are the things that can also influence strategy in the external environment. And then you have your service areas, your competitors, your governmental services, your business organization, nonprofit organizations, other local organizations, individual consumers. So you have these three areas: general environment, service areas, and healthcare environment. So all these three things, they impact each other. Process of environmental analysis. So process of environmental analysis, you have 4 different stages. You have your scanning, monitoring, and forecasting, and then analyzing stage. Your scanning stage involves viewing external environment information, organizing information into desired categories, identifying issues with each category. Monitoring involves specifying the source of data, adding to the environmental database, confirming or disproving issues, determining the rate of change within issues. Forecasting involves extending trends, developments, dilemmas, as well as occurrence of an event. Identifying the interrelationship between issues and between environmental categories, developing alternative projections. Assessing involves evaluating the significance of the external issues, identifying the forces that must be considered in formulation of vision, mission, internal analysis, and strategic plan. So scanning external environment, the objective there is to so scanning external environment objective is serve as the organization's window or lens on the external world, a process of viewing external organization in search of current and emerging trends or issues. Data collected, organized, and categorized, and accumulated, and then evaluated. Areas of environmental information categories involve technology, social and cultural, demographic, political, and regulatory, economics, competitive, as well as the customer. Information source involve people, whether it can be direct or indirect. Direct is within the organization, indirect is outside of the organization. Publication can be direct or indirect. It can be industry related, technical reports, database related. Also, indirect can be like your newspapers, your journal, or from your news outlets. Monitoring the external environment, the objective there is to accumulate data based around the identified issues. So basically investigating the sources of information, identifying the organization, creating the changes, and identify the source, reporting the changes. Forecasting environmental changes, the objective there is to answer the following question. If this trend continues, if the issue accelerates beyond the present rate, if the event occurs, what will the issue or the trend looks like in the future? So identifying the full range of possibilities is what forecasting is all about. Assessing environmental change, the objective there is to interpret the data based on perception, value, past experience, and the context. So basically, this is a process largely non-quantifiable and judgmental. So this is basically kind of looking at the data that you have and the result that is presented to you, and then kind of making a decision based on that. Assessing issues, there are 4 quadrants in terms of how you assess issues. You have one axis is impact on the organization, and the other axis is probability of trend continuing. So you go from high to low on each axis. So the critical issue to the right of the line should be addressed in the strategic plan, and then the critical issues to the left, to the right of the line should be addressed. So in terms of where you look at, so in terms of how you look at these 2 axes, you should look at whichever one has the highest probability, and that one is the one that you should address in your strategic plan, being the high impact, high probability. In terms of the environmental analysis tools and techniques, I'm not going to go much in depth into all of this because there's so much of them. So you have the simple trend identification and extrapolation. And I believe all these are given in your books. You have the advantages and disadvantages. You have the DEFI method. The DEFI method is very popular, by the way. It involves, the primary focus is scanning, monitoring, forecasting, and assessing. You use field experts, avoid intimidation. That's some of the advantages. It eliminates managerial bias. Some of the disadvantages involves members are physically dispersed, no direct interaction with the participants, with no, so it may take a long time to complete. You also have your nominal group techniques as well as your brainstorming session. These, you also see the advantage and disadvantages there and this is all in your book. I'm not gonna go through all of them because I don't have so much time. So in terms of strategic thinking questions for validation of your strategic assumption, you should ask, has the organization performance been adversely affected by unexpected or new trends or issues in general? Has the organization performance been adversely affected by unexpected new trends or issues in the healthcare environment? Has new opportunities emerged as a result of new trends, issues, or events in the external environment? Is the strategy acceptable to the major stakeholders? Are there new technology development that will affect the organization? Have there been social or demographic changes that affect market strategy, changes in ethnic mix, language barriers, or family structure? Has the legislative or political environment changed? Are there new local, states, federal regulations or laws being introduced, debated, or passed that will affect the operation or performance? Are there new economic issues? Have new competitors outside the industry considered entering into or local entering or actually entered into the health-related areas? Is the strategy subject to government response? Is the strategy in conformance to the society, moral, or ethnic code of conduct? So these are some of the questions that you should ask in your strategic endeavor. So by asking those questions, you should be able to get a very strong strategic management plan that you can be able to implement and can lead to a better success of your organization, but you have to make sure that you plan it well. So that's all I have for this evening. I hope that you were able to kind of pick out some good things that you can be able to use in your assignment. Okay, somebody asked a question. I noticed that the exam for this week isn't multiple choice. Any suggestion on how to study for it besides reading the chapters? So in terms of, I can give you the PowerPoint. I can send the PowerPoint over to you. That's the only thing I can say with regards to how you study, but I suggest you read the 2 chapters. That would be very helpful. Okay, I'll send the 2 PowerPoints over to you, chapter 1 and chapter 2. Okay, any other questions? All right, so that's all I have for today. So you have your assignments as well as your discussion posts. All right, thank you. You have your discussion post and your assignment, and remember everything is due on Saturday by 11:59 p.m. If it's late, then you will be subjected to some late points deductions. Okay, that's all I have. I hope you all have a very good evening, and I will post this recording on, like I showed you, it will be in the live sessions recording, so you can be able to view it later. So that's all I have. Well, you all have a very good evening, and I see you here again next week, Thursday by 7 p.m.